Do you know which is the largest organ of our body? Think for a moment. If you don't get the answer, I'll tell you. The largest organ of our body is the skin. One significant aspect of it is that it indicates the changes happening inside you. It tells you if you have developed diabetes or are at risk of developing it soon. Today, we will learn how you can estimate whether you have diabetes or are about to get it by looking at your skin. I will explain to you with the help of pictures that if you are experiencing these changes on your skin, you should be cautious. Don't be afraid of the terms or names you will see on the screen. I will explain them to you in simple language. Number 1. Granuloma annulare. These raised bumps can appear on your hands, around your knuckles, or on your arms. It is not necessary that they cause burning or pain, but sometimes they can cause mild itching. This condition is not contagious, so it is not a problem. It can also heal on its own. Research suggests that it happens due to inflammation in the body, caused by factors like diabetes, autoimmune thyroiditis, or severely high cholesterol levels. Some cancers can also lead to this condition. Number 2. Xanthelasma. Xanthelasma are yellowish cholesterol deposits that appear around the eyelids or inner corners of the eyes. While not exclusively linked to diabetes, their presence can be a sign of high cholesterol levels or uncontrolled diabetes. Xanthelasma occur when cholesterol builds up underneath the skin, leading to these yellowish growths or plaques. They are most commonly seen around the eyes because the skin in that area is very thin and delicate, allowing the cholesterol deposits to become visible. Number 3. Acanthosis nigricans. Acanthosis nigricans is a skin condition characterized by thick, velvety, dark patches of skin. These patches commonly appear in body folds and creases, such as the armpits, groin, and back of the neck. While acanthosis nigricans itself is not dangerous, it is often a sign of an underlying condition, particularly insulin resistance. Insulin resistance is a precursor to type 2 diabetes, where the body's cells become less responsive to insulin, a hormone that regulates blood sugar levels. Number 4. Eruptive xanthomatosis. Eruptive xanthomatosis appears as firm, yellow-red papules or nodules on the skin. These lesions typically appear on the buttocks, arms, legs, and trunk, but can also develop on the face and intertriginous areas. The lesions of eruptive xanthomatosis are called xanthomas, which are deposits of cholesterol and fats that accumulate within the skin. These xanthomas are often waxy or firm to the touch and can vary in size. They don't cause much pain, but they can be slightly troublesome. This condition is not contagious and does not spread from one person to another. It's important to note that eruptive xanthomatosis lesions can sometimes be confused with other skin conditions, such as erythema nodosum or papular mucinosis. Therefore, a proper diagnosis by a dermatologist or healthcare professional is crucial to ensure appropriate treatment and management. Number 5. Diabetic hand syndrome. In this condition, you may experience symptoms such as stiffness, thickening, and limited mobility in the hands. The skin on the palms may become waxy or thickened. This thickening is often accompanied by a limited range of motion in the fingers and an inability to fully extend or flex the fingers and wrist joints. Diabetic hand syndrome can significantly impact daily activities, such as grasping objects, typing, or performing fine motor tasks. There is a test you can do yourself. You need to fold your hands in a specific way, as I've shown. If you have diabetes, you might see a gap between your hands, and they won't join properly. You can also place your hand on a table. If there is a gap between your hand and the table surface, it could indicate diabetes. Number 6. Foot ulcers. If you repeatedly get sores or wounds on your feet that take a long time to heal, it could mean you have developed diabetes. This is a major sign of diabetes. Therefore, it is advised not to ignore foot wounds. These ulcers are open sores or wounds that develop on the feet, typically on the soles, toes, or between the toes. People with diabetes often cannot feel sensations on their skin. Even if they get a wound on their foot, they may not realize it because they cannot feel it. This lack of feeling leads them to further aggravate the wound, increasing their discomfort without even realizing it. This is because the touch sensations gradually diminish in people with diabetes over time. The ability to feel by touching something is a natural response of our body, but it becomes impaired in diabetes. Additionally, since blood circulation slows down in diabetes, and the high sugar levels in the blood further slow down the healing process. Infections become common. Number 7. Skin tags. Skin tags are often seen in people with diabetes, and they can be quite troublesome. Skin tags are small, benign growths of skin that protrude from the surrounding skin. They are typically flesh-colored or slightly darker and are attached to the skin by a thin stalk or peduncle. Additionally, skin tags can sometimes become irritated or bleed, especially if they are constantly rubbed against clothing or other surfaces. However, having skin tags does not necessarily indicate diabetes. They can also occur in other conditions like obesity, insulin resistance, or hormonal imbalances. Skin tags can also be genetic if they run in the family. Number 8. Diabetic dermopathy. Some people with diabetes may notice brown patches or spots on their skin, which is called diabetic dermopathy. This often happens because the small blood vessels in those areas get damaged, causing reddish or brown spots to appear, mostly on the lower legs or ankles. These lesions are usually painless and do not cause any discomfort, but they can be cosmetically concerning for some individuals. The patches may be round or oval-shaped and can vary in size. Number 9. Fungal infections. If someone has diabetes, they are more prone to fungal infections. Fungi thrive in moist areas, so these infections can occur in the armpits, groin area, under the breasts, or even inside the mouth. The main reason for fungal infections is a weakened immune system, which is a common problem in diabetes. Therefore, people with diabetes are prone to recurrent fungal infections, which can sometimes be life-threatening. Remember, fungal infections usually do not occur in healthy individuals with a strong immune system. Number 10. Bacterial infections. Certain bacteria, like staphylococcal species, can be more aggressive on the skin of people with diabetes, again, due to a weakened immune system. This can lead to recurrent bacterial infections. Additionally, poor circulation and nerve damage, which are often seen in diabetes, can make it easier for bacteria to gain a foothold and cause skin infections. They may appear as red, swollen, and tender areas on the skin, sometimes accompanied by pus or drainage. Number 11. Blisters. The appearance of blisters, especially on areas like the back, hands, feet, soles, or legs, may indicate long-standing, uncontrolled diabetes. When blood sugar levels remain consistently high, it can cause damage to the small blood vessels and nerves in the body. Consequently, this makes the skin more prone to injury and the development of blisters. While the presence of blisters alone does not necessarily indicate diabetes, it is a concerning sign when coupled with other symptoms or risk factors for the condition. If blisters are present, it is crucial to keep the affected areas clean and protected to prevent potential infections, as people with diabetes are more prone to complications from even minor skin injuries or breaks. So, I have mentioned 11 signs that, if you notice on your skin, indicate a high chance that you have or are at risk of developing diabetes. If you see any of these signs on your skin, it is crucial to get tested. Start with a fasting blood sugar test, and your doctor may recommend additional skin tests if they suspect something other than diabetes. The fasting blood sugar test is typically done after you have not consumed any solid food for the previous 8 hours, although you can drink water. It will be the doctor's job to examine any skin symptoms you have and determine through testing whether they are caused by diabetes or another condition. I hope this video was helpful. Stay tuned for more informative content. Thank you.